Welcome to Biohacking with Brittany. I'm your host, Brittany Ford, a registered holistic nutritionist and biohacker dedicated to exploring the latest in health, wellness, and optimizing the human experience. Each week, I bring you insightful conversations with experts, thought leaders, and innovators in biohacking, nutrition, and holistic living, along with solo episodes where I dive deep into topics I'm passionate about and share my personal journey. Join me as we uncover the science, tools, and strategies to help you take control of your health, naturally thrive, and unlock your fullest potential. Let's dive in. So today's episode is all about the controversial topic of making America healthy again. This idea kind of came from last week when I put out a thread or posted a thread, which is Facebook and Instagram's Twitter, essentially, or X. And I wrote, can Canada join Make America Healthy Again bandwagon, please? And that got reposted and so many likes and so many comments. So I thought, hey, why don't we kind of dig into this a little bit and actually take a look at how healthy America is right now, today. This episode is in no way reflection of my political views. I am a Canadian, first of all, so I can't even vote, and I didn't even vote in the recent election. However, when it comes to health, I definitely have my background, my education, my experience, and my opinions on things. And that's kind of what I do with this podcast and all of my content and work that I do. So that is really what we're focusing on today. It's not about who was elected, and other policies that Trump kind of agrees with or doesn't agree with, et cetera, et cetera. I'm not even touching any of that. It's just about the state of health in America today for every single person, why it's at this point, what the stats are showing, what we can do about it. And how do we climb out of the hole that we're in? And I say we as in kind of the collective here, North American collective. I also work and have worked with a ton of American brands and American clients. And so I can kind of see this a lot. I was also recently in Texas, which also made me think a lot about, the reality of trying to reach and maintain optimal health when I'm in these different neighborhoods that are on a different socioeconomic scale than where I currently live. And we are going to definitely dive into that. I'm going to definitely address accessibility and affordability of health and healthcare. I think that is such an important part of this whole discussion, and that will definitely be included. So thank you for listening. And before we dive in, a shout out to BiOptimizers. They are doing their biggest sale of the year for Black Friday this month. If you use my discount code BioHackingBrittany on top of their Black Friday sale, you get an extra 10% off, making everything 25% off their entire website. So they are a supplement company, and they specialize in things like magnesium, digestive enzymes, probiotics, a whole bunch of other things as well. I think they're best known for the magnesium because it's the only magnesium that has all 7 types of magnesium in it. So it is very robust and well-rounded. I take one every single night, and it's great. You don't have to worry about which magnesium you want to take for what concern. You're getting everything in one supplement. And so there's less work for you to do. Most people are depleted in magnesium. So this is probably the number one, mineral supplement that I recommend to people. And I have all of my family on. So again, if you are ready to kind of up your supplement game, definitely check out BiOptimizers. They have been in the game for so long. And I've been working with the brand for years. So use my discount code BioHackingBrittany and I will give you an extra percentage off, which I love to do, and help you save and also become healthier at the same time. And a quick shout out to my Baby Steps fertility course. So this is a preconception health course. It is going on sale for Black Friday. This will be the biggest sale I think I've ever done. The sale will be from Friday to Monday. And this is for everyone listening who is struggling with fertility, infertility, if you're a man or a woman, or you're just wanting to get pregnant in the next year. I did a 90-day cleanse with my husband and I before we started trying to have kids. And I talk a lot about this, and it's included in the course about how important preconception health is for creating a healthy womb, egg quality, improving your egg quality, improving sperm quality, and how that really sets the trajectory of your child's health. And also obviously helps with fertility and being successful at getting pregnant. So there's so much to say about this in this space. I dive all into it in my course. It's a 7-week online course. Do it at your own pace. It's very easy. And there's a lot of information in there. So definitely check that out. That's going on sale on Black Friday. So make note of that. And I will keep you updated. So follow me on Instagram at BIOHACKINGBRITTANY or TikTok at BIOHACKING. I'm most active on Instagram in my DMs and my stories. That's kind of my spot and will continue to be my spot until further notice. But yeah, definitely follow me. And yeah, I'd love to chat and hear your opinions on this episode. Okay. So make America healthy again. This phrase, as catchy as it is, stands for something much more significant. It's a call to action. It's a vision of a healthier future where we can address America's health crisis head on. Today, I'm going to break down why we're even talking about this and why it's needed. Is America one of the sickest countries in the world, in the developed world? What are the realities of Americans' health today? How did we get here? And most importantly, what can be done about it? I'm also going to talk about the socioeconomic disparities, healthcare access, and personalized healthcare. So let's dive in. The phrase "make America healthy again" resonates with a lot of people because it suggests we need to return to something we've lost. But when were we actually healthy? For many people, the 1950s and 1960s comes to mind. Listen, I wasn't alive during then, but when you see photos of people at the beach during those times, everybody is so fit and looks so vibrant and healthy. That era had lower rates of obesity, less processed food, and fewer chronic diseases. However, life expectancy has technically increased since then, thanks to medical advancements. So the question then isn't so much about living longer, but living better. And I do have another episode on comparing the lifespan versus health span that people talk about now. So this phrase reflects the desire to focus on improving the quality of life, not just lifespan. It's about reversing the epidemic of preventable diseases that has escalated due to poor diet, inactivity, and a flawed healthcare system. So making America healthy again is about finding a way to help Americans live fuller and healthier lives. Let's touch upon the political component to this of how this phrase has recently become super popular. So in 2024, food has unexpectedly become one of the biggest stories of the presidential campaign. Candidates are aligning their health and wellness policies to appeal to a public growing increasingly concerned with food and wellness issues. Kamala Harris had her whole side to this as well. But what I really want to talk about is Robert F. Kennedy Jr. and his claims. So he is the person who really brought this statement to light and to popularity, making health, wellness, and food issues core parts of his promises. According to the Food and Agricultural Organization, the externalized costs of food-related non-communicable diseases like diabetes, heart disease, and obesity for Americans surpasses 1.3 trillion each year. That is insane. 1.3 trillion each year for the cost of that. That's a staggering amount, and it's more than the value of all groceries sold annually in the US. The food industry is highly consolidated, has leveraged inflation to reap record profits, and uses ingredients in ultra-processed foods that are banned in other countries. So much so that in the book Seeding Innovation and the Unhealthy Truth, Robin O'Brien has pointed out some alarming facts. 1 in 2 American men are expected to get cancer in their lifetimes, and 1 in 3 American women. 1 in 3 American children has what are known as the 4 A's: allergy, autism, ADHD, and asthma. And cancer is a leading cause of death by disease in American children. She notes that most families are one serious illness away from financial ruin. In response to this crisis, Robert F. Kennedy Jr.'s initiative, Make America Healthy Again, is obviously gaining traction. Kennedy's vision isn't just about individualized health, but involves dismantling what he calls the corporate stranglehold on government agencies that oversee public health. Kennedy has stated MAHA, M-A-H-A, which is obviously Making America Healthy Again, seeks to drive a transformative agenda that includes prioritizing regenerative agriculture, preserving natural habitats, and eliminating toxins from our food, water, and air. For Kennedy, the chronic disease epidemic requires addressing root causes like poor diet, environmental toxins, and inadequate healthcare access, along with dismantling the corporate takeover of government agencies meant to protect public health and the environment. Whew, that's a lot. So, knowing the background of this statement, knowing why it's gaining traction, is America the sickest country in the world? What does the research show? Sadly, in many ways, yes. And I do want to caveat this with saying we're talking about the developing world here, or developed world versus developing, which used to be called first world and third world. Those terms are no longer used. So we are talking about developed countries. So sadly, in many ways, yes. According to recent OECD studies, the U.S. leads in preventable chronic diseases such as type 2 diabetes, obesity, and heart disease. The U.S. is also among the top when it comes to healthcare spending per capita. Yet despite this, health outcomes are shockingly poor when compared to other high-income nations. For example, the U.S. has the highest obesity rate in the developed world. The CDC reports showing that around 42% of American adults are obese. That's nearly half the population, and this number has only risen over recent decades. I want to point out that this research, 42% is obese. It's not overweight, right? There's a difference there. Obese is the next level, is 42%, which is insane. It's not just physical health either. Mental health issues are pervasive in America, with the National Institute of Mental Health reporting that 1 in 5 Americans live with a mental illness. So while America isn't the absolute sickest globally, among developed countries, it is alarmingly unhealthy. Some more statistics here about the reality of Americans' health today. Obesity, as I mentioned, 42% of adults are obese, and 19% of children fall into this category as well. 19%. Again, this is obesity and not overweight. Chronic disease, the CDC reports that around 60% of Americans have at least one chronic illness, and 40% have 2 or more. Common ones include hypertension, heart disease, and diabetes, many of which are lifestyle related. Life expectancy. America has one of the lowest life expectancies among developed nations and has even seen a decline in recent years. This is due in part to rising rates of suicide, drug overdoses, and health complications from chronic disease. I think this generation is the first generation to have a decline in health expectancy, whereas all previous generations, it has been on the incline. And then we have obviously the healthcare costs. The US spends more on healthcare per person than any other nation, around $12,500 USD per capita annually, yet struggles with poor health outcomes. So obviously these numbers paint a very, very clear picture. America is not a healthy country. The financial and human costs are staggering, and it's clear that there is change that is needed. So how did Americans get so unhealthy? Right? Like, who's at fault here? Where can we point the finger? It's obviously not as easy as it's a singular person's fault. There's way more complications to it. So the first thing we obviously need to address is the dietary shifts. Over the past 50 years, America's diet has shifted drastically and dramatically from whole, unprocessed foods to ultra-processed convenience foods. So now we don't just have processed foods, we have ultra-processed foods. The difference would be, for example, I would consider peanut butter a processed food that you buy. Even peanut butter that has, one ingredient and it's just peanuts, it's still processed. Peanut butter is not something natural that you find in the wild. But an ultra-processed food would be like a Snickers bar that has all sorts of nuts and different things in it. So the rise of fast food, sugary beverages, and highly processed snacks has led to a huge increase in calories, but a significant drop in nutritional value. According to research from the USDA, ultra-processed foods now make up more than 60% of the American diet, which is staggering. Do you like free stuff? Well, you're in luck because BiOptimizer's Black Friday deal starts now, and they are giving away free gifts with every purchase. That's right. I have an exclusive advance invite to BiOptimizer's Black Friday deal for the entire month of November. This is their best sale of the entire year, guys. If you're feeling stressed out or haven't been sleeping well lately, you are not alone. Story of my life. You might not be able to change all the chaos out there, but you can start supplementing with one key nutrient to improve your sleep quality, as well as over 600 other biochemical reactions in the body. That's wild. Magnesium Breakthrough is the only product I have found that has all the magnesium forms in one convenient bottle. You'll open less bottles, spend less money, and still get the top 7 forms of magnesium for better sleep, manage stress, balance hormones, improve mood, feel refreshed, all in one bottle. When you get all 7 critical forms of magnesium, pretty much every function in your body gets upgraded. Right now, for the entire month of November, BiOptimizers, the makers of Magnesium Breakthrough, are having a Black Friday blowout sale on all of their products. All month long, you get discounts with my unique code plus access to up to $100 in free gifts with purchase. This is the best time to stock up and take advantage of all the free extras you're going to get. Seriously, I would stock up for the entire year. You can get this exclusive deal through my link, especially made for you. You won't find this on Amazon or even on the company website. It's actually only through my link. So you can go to biooptimizers.com/biohackingbrittany and use my discount code biohackingbrittany to get your discount and free gifts today. One last thing you should know, all BiOptimizers supplements are best in class. If for some reason you feel differently, you can get a full refund for up to 1 year after your purchase, no questions asked, which is crazy. So again, guys, if you want to get magnesium, if you want to get their digestive enzymes, probiotic, mushroom breakthrough, all of the products that I love from them, November is easily the best time to do this. This will get you the most percentage off, the best price for the entire year, up to 25% off of everything, every single product. So go now, biooptimizers.com/biohackingbrittany. Use my discount code biohackingbrittany. It's going to be on my website. It's going to be in my show notes. It's going to be super easy for you to find. Enjoy this exclusive deal for November. Then we have our lifestyles, sedentary lifestyles. Physical activity has decreased drastically. Many jobs now involve sitting at a desk all day, and fewer people engage in physical labor. The CDC recommends at least 150 minutes of moderate exercise weekly, but studies show that a large portion of the population doesn't meet this standard. So let's talk about that. 150 minutes for a week. Okay. So I feel like that's nothing. I feel like that's such a small amount. That's what, 5 days? That's 30 minutes for 5 days. 30 minutes a day for 5 days is 150 minutes. What? That's 30 minutes. That's it. That's nothing. That's moderate exercise. That's going for a walk. That's not even like lifting weights. That's not even hitting a spin class. That's nothing. It's just wild that is, the recommendation. Just seems very, very low. And obviously, there's this other saying that people talk about as well, is like sitting is the new smoking. And I actually think screens are the new smoking. And I heard someone say that as well. And I totally agree. But they kind of go hand in hand of, we sit all day. We sit and we work at our computer, and then we come home and we sit on the couch and eat dinner and watch TV, and then we go to bed. We sit all day. When are we standing? When are we active? When are we moving? It's really hard to combat our lifestyle now. In the car, we're sitting as well. At school, we're sitting. It's at restaurants, like everywhere. We just sit all the time. Then we have the pharmaceutical dependency. In the US, we tend to treat symptoms rather than root causes. Prescription drugs are heavily advertised and widely used. While they can save lives, there's often an over-reliance on medication instead of addressing lifestyle factors. This is so true. If you turn on any TV, the amount of prescription drugs that are everywhere advertised is staggering. I was watching, what was I watching? I think I was watching an NHL game the other night. And you know how on the ice and on like the boards around the rink, there's like advertisements. The amount of advertisements I saw for Ozempic was wild. Wild. It's just everywhere now, everywhere. Then we have the mental health and chronic stress problems. So chronic stress has a massive impact on physical health. High stress levels, often exacerbated by long work hours, financial instability, and lack of mental health support, contribute to everything from high blood pressure to weakened immune systems. And last but not least, we have environmental toxins. We also face exposure to many environmental toxins, pesticides, industrial pollutants, and chemicals in consumer products. The cumulative exposure to these toxins can contribute to various health issues, including cancer, hormonal disruption, and more. So when we kind of look at how did we get to this point? Like how did Americans, whatever, get to be so unhealthy? There are multiple factors here. We have the dietary shifts. We have the change in lifestyle to sitting more and being on technology more. We have the mental health aspect with the chronic stress. We have the pharmaceutical industry selling us every drug to kind of suppress these symptoms. And then we have environmental toxins, EMFs, plastics, things in our water, things in our air, pollution. So it's not just, hey, eat whole foods and now, you're going to be healthy again. It's not as easy as that. Like, yeah, that's a massive step you can take, but it's not, it has to be a holistic approach in order to become healthy again, because what got us or Americans to this point of being so unhealthy is actually holistic as well. It's multifaceted, and it is partly in every person's control, but it partly is also in their environment and their society at large. What can we do about it? The golden question. What can we do about it? Where can we go? And I have a few different ideas, and I have a few different thoughts on this, in obviously relation to a lot of what I just talked about. So first of all, dietary changes. Switching to a diet rich in whole foods, vegetables, fruits, lean proteins, whole grains, healthy fats is fundamental. Studies from Harvard and the Blue Zones, I've actually been to one of the Blue Zones. It was incredible in Costa Rica, where people live the longest, show that a diet low in processed foods and high in natural, nutrient-dense options can lead to better health outcomes. Next, increasing physical activity. Finding ways to incorporate more movement into daily life is essential. This doesn't just mean spending hours at the gym. It could be as simple as taking daily walks, using a standing desk, or integrating quick exercise routines throughout the day. This physical activity is so personal, and there's so much access now and free content online that really you don't have much of an excuse. You can type into YouTube any type of workout you want to do, and there will be a video on it. If you want to do yoga, Pilates, learn about lifting weights, if you want to do something with a ball outside, soccer skills, if you want to do hockey, if you want to go for a run and become a runner, like it is wild the access we have now to content around fitness. This is a major, major important part into becoming healthier. I cannot stress it enough. Find what works for you and explore it and love it and have fun with it so that you actually stick to it. For me personally, where I am in my postpartum journey right now at 4 months, I use the Sweat app, which is phenomenal, and I'm following their postpartum fitness program. I have a Peloton and I use that, and I try to do that once or twice a week. I walk outside, and then I also have hot yoga studios in my community that I have started going to as well. That's kind of like my world right now. And I'm going to be honest with you, like I actually switch up my physical fitness, what I'm into, every 3 to 4 months because I get bored. So I'll get a new app. I'll try a new workout routine. I'll try more running, more cycling, and I always switch it up. And I've been doing that for years and years and years because I'm just not the type of person who can like stick to a fitness program for a year and call it a day. Like I get bored. So about every quarter, I kind of like switch things up, and I'll like get into yoga a lot or get into running a lot. And I actually think it's good for the body because then you're avoiding too much adaptation to your fitness routine and you're actually becoming healthier and fitter in different ways because you're switching it up so much. Then we have mental health support. Mental wellness is as crucial as physical wellness. Incorporating mindfulness practices like meditation, therapy, spending time in nature, and prioritizing relationships can significantly reduce stress. Thankfully, what we're seeing now with millennials and Gen Z is there's a lot of focus on mental health, which is great, which is really great. There's a lot of focus on anxiety and depression, OCD, whatever other mental health concerns people have. So I think in this space, it's becoming less taboo and people are really talking about how do I manage my stress? How do I become healthier? And I love seeing that. What else can we do about it? Access to preventative healthcare. Moving the healthcare system towards preventative care, focusing on early detection and lifestyle interventions would make a massive difference. For example, there's lots of different, programs. There's one called Kaiser Permanente's lifestyle medicine program, which emphasizes this model. There is a lot you can do with that instead of saying, hey, here, let me take this pharmaceutical to suppress the symptoms of my issue. Let's be preventative about it. Obviously, that comes with a cost, and I'm going to talk about that shortly. Last but not least, what else can we do about it? Health literacy. Education around healthy living needs to be widespread. People need resources to understand how their choices affect their health long term. That is why this podcast exists. That's why we are at over 300 episodes, and I have no plan to stop anytime soon, is because even if one person listens, they can become more health literate and they can make healthier choices, and that can impact their friends, that can impact their family, and it can have a ripple effect. It could change their life. It could change their life. It could be the difference between starting a new fitness program and not, which then helps them manage their blood sugar better, which then helps them have different cravings. And now they're not craving processed food, which over years could delay diabetes, right? Like that is the difference. So that's why I consume a lot of health podcasts content. Like I consume a lot of content. Take your pick, like from podcasts to YouTube to TikTok, wherever you want to be. Books, go old school, get a book. Sure. I read books as well. Whatever you want your input to be, I encourage you to find your stream of health content and, drink from it weekly. Oh, what a weird analogy. I don't know where that came from, but seriously, have some sort of input that comes in weekly so that you can actually learn and educate yourself and educate the people around you. Also, most health content, at least my content, is free, right? Yes, you have to have a phone. Yes, you have to have the apps, sure. Or a computer to watch YouTube, sure. But most people have those things in America. So the content itself is free. I do want to talk about the socioeconomic realities of health in America, because I'm not about to sit here and say, start this fitness routine, only shop at Whole Foods, get all of these supplements, put a sauna in your house. Like, let's be real. Let's actually be real. How many people can afford that? How many Americans can afford that? Not a lot. Okay. So let's be real about these recommendations about what we can do. There is a lot of income inequality in America. Lower income communities often don't have access to fresh food or safe spaces for physical activity. Food deserts, urban areas without fresh, affordable food, are widespread in low income neighborhoods. So what do you do? I don't even know if I'm the person to actually make recommendations on that. Probably not, because that's not my reality. So it almost feels not appropriate for me to make recommendations about that. The one thing I will say is that in terms of the physical activity part, if you have a home, which most people do, if you have a home, you can do, workouts at home for free. Like you can do, I guess once you learn it, you could do things like yoga by yourself. You could do body workouts, body weighted workouts that don't require weights or any equipment. No equipment workouts are huge. Again, there's a bunch of videos and content about that online that you could do in your home. I understand that you might not live in a neighborhood that it's safe to run in, or you might not live in a neighborhood that has hot yoga classes or, spin classes or anything like that. And so it's really like, how do you actually get inspired to become physically active when the society and community that you're living in isn't super safe? It is a very, very complicated and hard question to answer. Then we have education and health literacy, which I kind of briefly talked about. Individuals with higher education levels tend to have better health outcomes. This isn't just about knowledge, but also about access to resources and knowing how to navigate the healthcare system. Then we have work-life balance. Americans work longer hours with less vacation time than most developed countries. This has created a culture of burnout, which leads to unhealthy eating, lack of exercise, and poor mental health. Yikes. I don't think the 9 to 5 is really a 9 to 5 anymore. I know for me as a business owner, it's definitely not 9 to 5. Like 40 hours a week, that I don't remember there. Like, obviously I have a baby right now, so I'm not working full time. But prior to, right up until birth, I was definitely working over 40 hours a week, for sure. My husband works over 40 hours a week. I don't know a lot of people who just do a 9 to 5 as much anymore. I think it's become 8 to 5, 8 to 6, 8 to 7. Then people have side hustles. People go to and, work on weekends, work at nights, work at bars to make cash, to make tips, whatever, restaurants, whatever you're doing, because of the economic climate that we're in, that so many things are unaffordable for the average person, especially if you're living in large cities and big cities. It's really hard to be able to afford to live in those places, or be able to afford a car or house, or to start a family, or any of these things. So then we work more. And so then our work-life balance is worse. And then when we're not working, the question becomes, do I want to spend that time cooking healthy food, shopping at a grocery store, working out, meditating? Or do I want to sit on the couch and watch TV and Uber Eats my food? And then I'm good. And it's easier and faster. But I'm spending money. You're spending money regardless, but it's faster and it's done. And so that's like the toxic, never-ending cycle that so many people are in. And that part is not your fault, right? Like, that part of the economy being as complicated and hard as it is right now is a reflection of a lot of different things. And that, it might get better. I guess we're going to see. And last but not least, we have government policies. So government subsidies often favor large-scale agriculture, which produces the cheap processed foods flooding the market. In contrast, countries like Denmark and Sweden prioritize public health by investing in healthy, fresh food initiatives and preventative care. That's what I find interesting. Is like America, there are other countries that are doing this. Why don't you try and copy what they're doing? Learn from them. Learn from places like Denmark and Sweden that put money into fresh food initiatives and preventative care, right? Versus pharmaceuticals and the situation right now. Obviously, healthcare in America in general is private, and public healthcare is not great. For private healthcare, while often providing excellent care, it's inaccessible to millions due to the cost. Many avoid necessary treatments because of high deductibles and out-of-pocket costs. Personalized healthcare, which I'm going to get into as well with functional medicine, but personalized healthcare has potential and is actually gaining traction. So there's potential for personalized healthcare to make a big difference. And I actually do think it is already making a big difference. And it's a bit more accessible because I'm talking about things like at-home testing. You could do at-home genetic testing, at-home blood testing, looking at your different biomarkers of vitamins, minerals, hormones. You can get wearable tech like Oura Rings or a smartwatch. And these provide insights into individual health needs. There are many companies that do this. I love SiPhox. I think SiPhox is one of the cheapest at-home blood tests you can do. I will link it in the show notes. They do hormones, inflammation. I just learned my inflammation's high from pregnancy and birth. And they also do hormones and vitamins and minerals and all sorts of things like that. So I will link that for you. And I have a discount code if you want to get it. However, this is still costly and primarily available to those with means. So while personalized healthcare is definitely gaining traction, again, you have to have money for it, right? Like you have to be able to afford it. So it's hard. It's hard and it's complex. And so it's no wonder America is in such a deep hole with this, because the solution is multifaceted and really needs to be something that takes into the socioeconomic status of low-income communities in order for there to actually be systemic change and change that lasts a long time. I want to briefly mention the role of functional medicine in making America healthy again. One solution that more people are exploring today is working with a functional medicine practitioner. Functional medicine offers a unique approach because it focuses on identifying and addressing the root causes of disease rather than just treating symptoms. This can be incredibly effective, especially for those dealing with chronic health issues that conventional medicine might only manage rather than resolve. Functional medicine practitioners typically spend more time with patients, taking detailed histories and looking at a broad range of factors like lifestyle, nutrition, stress, and genetics. They utilize advanced lab testing to get a deeper understanding of how the body is functioning at a biochemical level, which can reveal things that standard tests might miss. The treatment plans they offer are highly individualized and often include diet, lifestyle changes, and natural therapies rather than just medication. For many people, working with a functional medicine practitioner has been transformative, and conditions that seemed untreatable or complex, like autoimmune diseases, digestive disorders, and even mental health issues, often improve when approached from a functional medicine perspective. Functional medicine aligns perfectly with the Make America Healthy Again vision because it promotes a preventative, holistic approach that can help reduce the overall burden of chronic disease on the healthcare system. I shout that out because, first of all, I'm thinking of going to study to become a functional medicine practitioner. So it's on my brain. Secondly, it is one of the only professions that I've seen that does this focusing on the root cause approach with a holistic solution and is comprehensive and medical in nature versus, a naturopath who kind of will look at the root cause, but not as much and doesn't do as much like lab testing and personalized healthcare. Or Chinese medicine will then only recommend, herbs, acupuncture, cupping, whatever is in their scope. I think the functional medicine model brings in a bunch of different healing modalities more than the other alternative practitioners that I'm currently seeing. So I think this is a good solution. Again, working with a functional medicine practitioner takes money, and I 100% agree that it is not affordable for most people in America today. Practical takeaways, okay? What can we do? I talked about what we can do if you have money, if you don't have money, where you live, all those things. I talked about the state that we're in. But let's talk about practical takeaways for everybody, every single person listening right now, no matter what your background. Start with small, realistic changes. Replace sugary snacks with fruit. That's easy. Add more vegetables to meals and find ways to move each day. Start subbing your fries with a salad. Yeah, it's not organic. Yeah, it's got pesticides on it. Sure. But it's still better than the fries. It's still better. Okay. Prioritize your mental health through mindfulness, connections with loved ones, and even therapy if you have access. Take preventative action by getting regular health screenings, whether through your doctor or new consumer health tech, if you have access. Again, I think these small steps can actually make a big difference if everyone were to prioritize doing one or two a day. In summary, America's health crisis didn't happen overnight, and reversing it won't either. But by educating ourselves and making incremental changes, Americans can start being healthy again. Working with a functional medicine practitioner can be a valuable tool in this journey, providing a personalized and preventative approach that aligns perfectly with this mission. While systemic changes are essential, which kind of come from the government and come down, the real work does actually begin at home. I hope today's episode has inspired you to even just take one small, tiny step towards being healthier. Thank you for tuning in to Biohacking with Brittany, and I look forward to helping you become healthy, enjoying your day and becoming healthier and, increasing your health span, not just your lifespan. And it really just takes one conscious choice at a time. I release episodes every Tuesday and Friday, and I will catch you soon for another episode. Feel free to send me a message on Instagram at BioHackingBrittany for what you think about this episode, what you think about the state of America's health. I'd love to chat and hear about your opinions. And I will catch you soon for another episode. Thanks for listening to another episode of Biohacking with Brittany. If you're interested in finding the show notes or the sponsors for this episode, you can do so on my website, which is biohackingbrittany.com. Remember to follow me on Instagram, where I'm most active. My handle is at biohackingbrittany. And if you're interested in working together and you want to email me directly, you can do that. My email is info@biohackingbrittany.com. And I look forward to hearing from you and having you tune in next week.